CEN written exams in Georgia. Question 1. A patient with Guillain-Barré syndrome is admitted with rapidly progressing weakness. The CEN should monitor for Option A, hyperthermia. Option B, respiratory failure. Option C, hypertension. Option D, tachycardia. The correct answer is option B, respiratory failure. Guillain-Barré syndrome is an acute demyelinating polyneuropathy that causes ascending weakness. The most serious complication is respiratory failure due to respiratory muscle weakness, diaphragm and intercostals. CENs should monitor vital capacity, negative inspiratory force, NIF, and tidal volume. Intubation may be necessary if vital capacity drops, 15 ml/kg, or NIF decreases, -20 cm H2O. Question 2. A patient with increased intracranial pressure, ICP, from a head injury has a Glasgow Coma Scale, GCS, of 8. Which finding is most concerning for elevated ICP? Option A, Cushing's triad, hypertension, bradycardia, irregular respirations. Option B, tachycardia and hypotension. Option C, dilated pupils with brisk response. Option D, restlessness. The correct answer is option A, Cushing's triad, hypertension, bradycardia, irregular respirations. Cushing's triad, hypertension, bradycardia, and irregular respirations, is a classic, late sign of increased ICP, indicating brainstem compression and imminent herniation. This requires emergent intervention, elevating the head of the bed to 30 degrees, hyperventilation, target PaCO2 30 to 35 mmHg, osmotic therapy, mannitol or hypertonic saline, and possibly surgical decompression. Tachycardia and hypotension suggest shock, not elevated ICP. Unilateral pupillary dilation suggests herniation. Question 3. A patient presents with a panic attack, shortness of breath, chest tightness, and paresthesia. The CEN should: Option A, apply a paper bag to rebreathe CO2. Option B, provide reassurance and instruct the patient to take slow breaths. Option C, administer a benzodiazepine. Option D, perform an ECG. The correct answer is option D, perform an ECG. Chest pain and shortness of breath in any patient should be evaluated for medical causes, ACS, PE. An ECG, vital signs, and appropriate labs should be done. While panic attacks are a common cause of hyperventilation, the CEN should not assume this without ruling out life-threatening conditions. If organic causes are ruled out, reassurance and breathing exercises are helpful. Question 4. A patient in the ED is agitated and at risk of harming themselves. The CEN should use which type of restraint? Option A, physical restraint only. Option B, chemical restraint. Option C, physical or chemical restraint, as indicated. Option D, seclusion. The correct answer is option C, physical or chemical restraint, as indicated. Restraints, physical or chemical, are used to protect the patient or others from harm. They should be used as a last resort when de-escalation has failed. Physical restraints include soft limb restraints, chemical restraints include medications, haloperidol, benzodiazepines. The CEN should monitor the patient closely and reassess for the need for restraint. Question 5. Which assessment finding indicates spinal shock? Option A, loss of reflexes below the level of injury. Option B, muscle spasticity. Option C, hyperreflexia. Option D, autonomic dysreflexia. The correct answer is option A, loss of reflexes below the level of injury. Spinal shock is a transient condition following acute spinal cord injury characterized by loss of reflexes below the level of injury, flaccid paralysis, loss of sensation, and bowel/bladder dysfunction. This phase lasts hours to weeks and is replaced by hyperreflexia as spinal shock resolves. Autonomic dysreflexia is a later complication. Question 6. A patient presents with suicidal ideation and a specific plan to overdose on pills. The CEN should: Option A. Ask the patient to sign a no-harm contract. Option B. Place the patient on a 1:1 observation and initiate a psychiatric hold. Option C. Discharge the patient home with a safety plan. Option D. Administer a benzodiazepine to calm the patient. The correct answer is option B. Place the patient on a 1:1 observation and initiate a psychiatric hold. Patients with suicidal ideation with a specific plan require 1:1 observation, suicide precautions, and a legal psychiatric hold, 5150, Baker Act, etc. A no-harm contract is not sufficient and may provide a false sense of safety. Discharge is contraindicated. Benzodiazepines may be used for agitation but are not the primary intervention. The CEN should remove all potential self-harm items, sharp objects, belts, etc., and ensure constant observation. Question 7. A patient who is 8 weeks pregnant presents with vaginal bleeding and unilateral pelvic pain. Which diagnosis should the CEN suspect? Option A. Miscarriage. Option B. Ectopic pregnancy. Option C. Placenta previa. Option D. Normal pregnancy. The correct answer is option B. Ectopic pregnancy. Ectopic pregnancy should be suspected in any woman of childbearing age with abdominal/pelvic pain and vaginal bleeding, especially with risk factors, history of PID, tubal surgery, or IUD use. Unilateral pelvic pain, hypotension, and shock can occur with a ruptured ectopic pregnancy. Quantitative HCG and transvaginal ultrasound are diagnostic. Ruptured ectopic pregnancy is a surgical emergency. Question 8. A patient presents with heat stroke, temperature 40.5 degrees Celsius, 105 degrees Fahrenheit, confusion, and hot, dry skin. The priority intervention is: Option A. 4 fluids. Option B. Cooling measures, ice packs, cold water immersion. Option C. Antipyretics, acetaminophen. Option D. Neurological assessment. The correct answer is option B. Cooling measures, ice packs, cold water immersion. Heat stroke is a life-threatening emergency requiring rapid cooling. The priority is to lower the core temperature as quickly as possible using ice packs, cold water immersion, or evaporative cooling. Antipyretics are ineffective in heat stroke because the pathophysiology is not hypothalamic. Cooling should be done until the core temperature reaches 38.9 degrees Celsius, 102 degrees Fahrenheit. 4 fluids are supportive. Question 9. What is the chain of custody in the context of forensic evidence? Option A. The sequence of people who handle a sample, ensuring it is not tampered with. Option B. The chain of command in the ED. Option C. The medication administration record. Option D. The patient's medical records. The correct answer is option A. The sequence of people who handle a sample, ensuring it is not tampered with. The chain of custody is the documentation of every person who has handled a piece of evidence, e.g., blood, urine, clothing, from the time it is collected until it is presented in court. Maintaining the chain of custody ensures the evidence is not tampered with, lost, or contaminated. This is crucial in forensic cases, sexual assault, violence, etc. Question 10. A patient with a crush injury to the lower extremity presents with pain, swelling, and dark urine, tea-colored. Which complication is the CEN most concerned about? Option A. Compartment syndrome. Option B. Rhabdomyolysis. Option C. Fat embolism. Option D. Infection. The correct answer is option B. Rhabdomyolysis. Crush injuries can lead to rhabdomyolysis, characterized by muscle breakdown and release of myoglobin, leading to dark, tea-colored, urine, elevated creatinine kinase, and risk of acute kidney injury. Treatment includes aggressive 4-hydration, normal saline, alkalinization of urine with sodium bicarbonate, and possible dialysis. Compartment syndrome can also occur, but dark urine is a classic sign of rhabdomyolysis. Question 11. A patient with a dislocated shoulder should be assessed for which complication? Option A, vascular injury. Option B, nerve injury, axillary nerve. Option C, fracture. Option D, all of the above. The correct answer is option D, all of the above. A dislocated shoulder requires a neurovascular assessment before reduction to identify any injury to the axillary nerve or axillary artery. Fractures, Hill-Sachs lesion, Bankart fracture, may also be present. Documenting the neurovascular status is essential before and after reduction. The patient should have an X-ray before and after reduction. Question 12. A patient with anaphylaxis presents with stridor, hypotension, and respiratory distress. The CEN should: Option A, administer epinephrine IM. Option B, administer epinephrine 4. Option C, administer albuterol nebulizer. Option D, administer diphenhydramine 4. The correct answer is option B, administer epinephrine 4. IM epinephrine is first line for anaphylaxis, but in severe cases with hypotension and stridor, airway compromise, 4-epinephrine may be needed. 4-epinephrine is a more potent vasoconstrictor and inotrope, reserved for severe presentations. Albuterol and diphenhydramine are adjuncts, not primary. Question 13. A patient with suspected carbon monoxide poisoning has a headache, nausea, and confusion. The CEN should: Option A, administer high-flow oxygen via a non-rebreather mask. Option B, obtain a CT head. Option C, administer activated charcoal. Option D, obtain a carboxyhemoglobin level. The correct answer is option D, obtain a carboxyhemoglobin level. CO poisoning presents with headache, nausea, confusion, and cherry red skin, late sign. The diagnosis is confirmed with a carboxyhemoglobin, COHB, level. Treatment includes high-flow oxygen, non-rebreather mask. Hyperbaric oxygen therapy may be indicated for severe cases, COHB 25%, cardiac ischemia, neurologic symptoms, or loss of consciousness. CT is for head trauma, charcoal is not indicated for CO poisoning. Question 14. A patient presents with severe crushing chest pain. The ECG shows ST segment depression and T-wave inversion in leads 2, 3, and AVF. This is most consistent with: Option A, anterolateral STEMI. Option B, inferior STEMI. Option C, non-ST elevation myocardial infarction, NSTEMI. Option D, pericarditis. The correct answer is option C, non-ST elevation myocardial infarction, NSTEMI. ST segment depression and T-wave inversion without ST elevation indicate NSTEMI, or unstable angina. Inferior leads, 2, 3, AVF, show ischemic changes. NSTEMI management includes antiplatelet therapy, aspirin, ticagrelor, anticoagulation, and possible PCI depending on risk stratification, Grace score. STEMI requires emergent reperfusion, while NSTEMI is managed with a more nuanced approach. Question 15. A patient with a spinal cord injury at the C5 level is experiencing neurogenic shock. Which findings are consistent with this? Option A, hypotension, bradycardia, and warm, dry skin. Option B, hypertension, tachycardia, and cool, clammy skin. Option C, hypotension, tachycardia, and warm, dry skin. Option D, hypertension, bradycardia, and cool, clammy skin. The correct answer is option A, hypotension, bradycardia, and warm, dry skin. Neurogenic shock results from loss of sympathetic tone following spinal cord injury above T6, leading to unopposed parasympathetic tone. This causes hypotension, bradycardia, and warm, dry skin, vasodilation. This is in contrast to hypovolemic shock, cold, clammy, tachycardia, and cardiogenic shock. Treatment includes 4 fluids and vasopressors. Question 16. A patient has a smoke inhalation injury. Which finding should raise concern for carbon monoxide poisoning? Option A, cherry red skin color. Option B, headache, confusion, nausea. Option C, SpO2 95% with significant distress. Option D, all of the above. The correct answer is option D, all of the above. Carbon monoxide, CO, poisoning causes headache, confusion, nausea, and, later, cherry red skin color. Pulse oximetry, SpO2, may be falsely normal because it cannot distinguish between oxyhemoglobin and carboxyhemoglobin. Treatment includes 100% oxygen, non-rebreather mask, and possibly hyperbaric oxygen therapy for severe cases. CO levels should be measured by CO oximetry. Question 17. A patient with cardiac arrest has a rhythm of ventricular fibrillation, VF, on the monitor. The patient has received 2 defibrillation attempts and 1 dose of epinephrine. What is the next medication to administer? Option A, amiodarone 300 mg 4 push. Option B, lidocaine 100 mg 4 push. Option C, magnesium sulfate 2 grams 4. Option D, sodium bicarbonate 50 ml equivalent 4. The correct answer is option A, amiodarone 300 mg 4 push. For shock refractory VF/pulseless VT, the ACLS algorithm recommends amiodarone 300 mg 4/IO push after the second shock. A second dose of 150 mg may be given for recurrent VF/VT. Lidocaine is a second-line alternative. Magnesium is for torsades de pointes. Sodium bicarbonate is not routinely recommended except in specific scenarios, hyperkalemia, tricyclic overdose. Question 18. A patient presents with suspected abuse, elder abuse or child abuse. The CEN should: Option A, report the suspected abuse to the appropriate agency. Option B, confront the suspected abuser. Option C, keep the information confidential. Option D, delay reporting until the patient is discharged. The correct answer is option A, report the suspected abuse to the appropriate agency. Suspected abuse, elder abuse, child abuse, domestic violence, or human trafficking, is mandatory reporting in all 50 states. The CEN should report to the appropriate agency, CPS, APS, or law enforcement. The CEN should not confront the abuser. This is the role of the social worker or law enforcement. Confidentiality does not apply in cases of suspected abuse. Question 19. A patient with stable supraventricular tachycardia, SVT, is not responding to vagal maneuvers. Which medication should the CEN anticipate? Option A, amiodarone 150 mg 4. Option B, adenosine 6 mg rapid 4 push. Option C, diltiazem 20 mg 4. Option D, metoprolol 5 mg 4. The correct answer is option B, adenosine 6 mg rapid 4 push. Adenosine is the first-line medication for stable SVT. It is given as a rapid 4 push, 1 to 2 seconds, followed by a 20 ml saline flush. The initial dose is 6 mg. If ineffective, a second dose of 12 mg may be given. Adenosine works by transiently blocking AV node conduction. Amiodarone, diltiazem, and metoprolol are also used for rate control in certain tachyarrhythmias but are not first line for SVT. Question 20. Which triage system is used in mass casualty incidents? Option A, START, simple triage and rapid treatment. Option B, SALT, sort, assess, life-saving interventions, treatment/transport. Option C, Manchester triage system. Option D, Both A and B. The correct answer is option D. Both A and B. Start, simple triage and rapid treatment, and SALT, sort, assess, life-saving interventions, treatment/transport, are the triage systems used in mass casualty incidents. START categorizes patients into 4 categories: red, immediate, yellow, delayed, green, minor, black, deceased/expectant, based on respirations, pulse, and mental status. SALT is a more comprehensive version. Question 21. A patient with acute pelvic pain, vaginal bleeding, and hypotension has a positive pregnancy test. Which intervention is the priority? Option A, transvaginal ultrasound. Option B, 4 fluids and cross-match blood. Option C, beta HCG level. Option D, surgical consultation. The correct answer is option B, 4 fluids and cross-match blood. This patient is hemodynamically unstable, hypotension, positive pregnancy test, vaginal bleeding. The priority is stabilization with 4 fluids and preparation for blood products, as a ruptured ectopic pregnancy is likely. While ultrasound and surgical consultation are important, volume resuscitation is the immediate priority to prevent hemorrhagic shock. Question 22. A patient with a stroke is within the 4.5-hour window for TPA. The CEN should: Option A, obtain a CT head to rule out hemorrhage. Option B, check the blood pressure, target 185/110 mmHg. Option C, prepare for TPA administration. Option D, all of the above. The correct answer is option D, all of the above. TPA is indicated for acute ischemic stroke within 4.5 hours of onset. The protocol includes CT head to rule out hemorrhage, blood pressure control, 185/110 mmHg, and preparation for TPA administration. If the patient is a candidate, TPA is given, and the patient is monitored in a stroke unit. Question 23. A patient with a stroke is being transferred to a comprehensive stroke center. Which law applies to the transfer? Option A, EMTALA. Option B, HIPAA. Option C, OSHA. Option D, ACA. The correct answer is option A, EMTALA. EMTALA governs the transfer of patients between hospitals, ensuring that patients are transferred only after they have been stabilized, or if the benefits of transfer outweigh the risks, and that the receiving facility has accepted the patient. The transfer must be done with appropriate documentation and personnel. EMTALA applies to emergency care. Question 24. What is the most common dysrhythmia associated with acute myocardial infarction? Option A, atrial fibrillation. Option B, ventricular tachycardia. Option C, ventricular fibrillation. Option D, premature ventricular contractions, PVCs. The correct answer is option D, premature ventricular contractions, PVCs. PVCs are the most common dysrhythmia seen in acute MI, often indicating myocardial irritability. While ventricular tachycardia and ventricular fibrillation are more dangerous, PVCs are more frequent. Atrial fibrillation can also occur but is less common. Reperfusion therapy and antiarrhythmic management are key strategies. Question 25. A patient is suspected of being a victim of human trafficking. The CEN should: Option A, notify security and social work. Option B, notify law enforcement. Option C, provide a private space for assessment. Option D, all of the above. The correct answer is option D, all of the above. Human trafficking is a serious crime. The CEN should recognize signs and screen patients for trafficking. The patient should be assessed in a private space away from their companion, who may be the trafficker. Security and social work should be notified. Law enforcement should be notified if there is suspicion. The patient's safety and privacy are essential.